The following lecture details guidelines and practices to minimize risk in the MRI environment. Deaths and serious injuries have occurred in MRI. These events are typically related to unsafe practices, failure to follow safety policies, or gaps in safety procedures. Equipment failure rarely is the cause of serious events. The main safety concerns in MRI are caused by the generation and presence of three independent magnetic fields: the static magnetic field, or B0, the time-varying radiofrequency magnetic field, or B1, and the time-varying gradient magnetic field. The static magnetic field, or B0, is always on. This field is measured in Tesla, and it's used to polarize proton spins. This field and the spatial field gradients that surround the MRI in all directions are the source of large magnetic forces on ferromagnetic objects entering the environment. The magnetic field sharply increases the closer you get to the MR system. Current FDA scanners use fields between 0.06 and 7 Tesla. The main risks of the static magnetic field include ferromagnetic object translation and torque, as well as projectile events. These risks are always present, even when not imaging, as the magnetic field is always on. The 5-Gauss line is historically known as the pacemaker line, or the point at which cardiac devices were affected by the static magnetic field. This line can be found in all MRI rooms on the floor. The current standards require pacemakers to be immune to static fields up to 10 Gauss. So it's more accurate to consider this 5 Gauss line as the boundary of the B0 hazard area. So before entering the MR room, stop, check your pockets for metal, and check all equipment for metal using ferrous metal detectors. Now, time-varying radiofrequency magnetic fields, or the B1 field, is a much smaller magnetic field oscillating at the MR frequency, and it's used to excite or manipulate the polarized spins. These fields are characterized by their amplitude, frequency, and duty cycle. But this field is only present during imaging. Now, the main risks of the B1 field are general patient heating, localized heating resulting in burns, as can be seen below, unintended stimulation, and device malfunction. It's important to note that MRI-associated burns are the most frequently reported injury in MRI. Now, the time-varying gradient magnetic field, these are linear magnetic fields that are pulsed during image acquisition. And they're characterized by their magnitude in space as well as the rise time. These fields are only present during imaging, and the rapid switching of current through these coils is the source of the loud acoustic noise during imaging. The main risks of this field include acoustic injury, and so any patient or subject in the MRI must wear earplugs or have earphones or other forms of hearing protection. Additional risks include induced voltage or current, as well as implant device malfunction. So there are numerous dangerous objects for MRI, and these include beds and wheelchairs, oxygen tanks, IV poles and drug pumps, pacemakers, surgical wires and other implanted devices, scissors, hemostats, stethoscopes, keys, cleaning equipment, hand tools, watches, pagers, cell phones, and credit cards. Other potential safety concerns include cryogens. Liquid helium is used in many systems to maintain magnetic superconduction. And the risk associated with cryogens occurs during magnet quenching, which is a rapid loss of the magnetic field. Now, every MR suite has an emergency quench button that looks like this. And this is only used when there's a life-threatening emergency. For example, when a patient is trapped within the bore of the magnet. During a quench, the liquid helium boils off into a gas and is vented outside via large quench pipes. Now, helium gas can stay within the scan room, displacing oxygen, and can cause asphyxia and death. The area around an MRI is divided into 4 safety zones, from the least restrictive to most restrictive. Zone 1 is a general public area with no restrictions. Zone 2 is the interface between publicly accessible and controlled access regions. Zone 3 is controlled access and is restricted by a locked door, as can be seen in the image here. And Zone 4 is the MRI scan room itself. Here, access is restricted to screened patients or subjects and trained MRI personnel. Additionally, there is a locked door between Zone 3 and Zone 4. Prior to entering Zone 3 and 4, patients and subjects are screened for the presence of any device or implant that is not MR conditional. This is an example of a patient screening questionnaire, and this the exact outlay will depend on different sites. Okay. Below is a list of MR conditional and devices and implants. Any device that can be scanned under very strict conditions has the label of conditional. Currently, there are conditional pacemakers and internal cardiac defibrillators, spinal cord stimulators, deep brain stimulators, vagal nerve stimulators, cochlear implants, and ventricular peritoneal shunts, as well as infusion systems, or aneurysm clips that were placed after 2000, and orthopedic hardware. For more information on MR safety in general, as well as MR conditional devices and clearance, please see the resources below.